Hi, my name is Rafael Charmby Resterio from 8 Lithium, and this is my video on different caregiving tools and equipment for cptle. I hope you enjoy watching and thank you! Today, my job is to show you all the different types of caregiving tools and how to use them. But firstly, what are caregiving tools? Caregiving tools. Caregiving tools provide care for the physical and emotional needs of a family member or a friend at home. Caregiving may involve assisting with meals, personal care, and transportation, helping with medical procedures and therapy. Caregiving tools are important as they help in the care of patients. The caregiving tools can be used by caregivers to provide better care for those they are tasked with looking after. It is important that you are aware of all the tools that can help you because it will make your job easier and more enjoyable. The different types of caregiving tools are monitoring devices, healthcare aids, linens, disinfectants, eating utensils, cleaning supplies, toilet needs, toilet requisites, and medical dressings. Monitoring devices. Monitoring devices are used to ease worries about the fundamental health conditions of patients. It is a display produced by a device that takes signals and displays them on a television screen or computer monitor. The different types of monitoring devices are the sphygmomanometer or the blood pressure monitor, the stethoscope, and the thermometer. Hi! I am here to show you how a wrist blood pressure monitor works. A blood pressure monitor is used to track one's blood pressure. You do not use it like this or like this, but rather like this, which is on level with your heart. You press the start button to make it turn on. While waiting, you can see that it is starting to tighten up around your wrist, which is meaning that your blood pressure monitor is working. A blood pressure monitor has two numbers, which is the systolic blood pressure and the diastolic blood pressure. A systolic blood pressure measures the pressure in your arteries when your heart beats. A diastolic blood pressure measures the pressure in your arteries when your heart rests between beats. It also has a pulse, which is the regular movement of blood through your body that is caused by the beating of your heart and that can be felt by touching certain parts of your body. It's done! Look how easy that was. My blood pressure is 138/96 and my pulse is 91. Hi! So what I have here is a digital thermometer. A thermometer, in general, is used to take one's body temperature. You use it for people who have fevers or if you just want to take your body temperature. So you'd start to press it on by pressing this button. Now, you put it on your armpits and wait for a few seconds for it to turn on. It usually takes about 5 seconds for it to read your body temperature. Now, I assume this is already done, so let's take it out. My body temperature is 36.0 degrees. Look how easy that was. Healthcare aids. Healthcare aids provides direct care, personal assistance, and support to patients who are ill, elderly, or disabled. They assist patients with activities such as bathing, grooming, dressing, and toileting. They may help with feeding or exercise. In some settings, help patients take their medications. These healthcare aids are the ice bag, the foot support, the measuring glass, and the steam inhalator. Now, since I do not have any of these healthcare aids, I will now be saying the definitions from the book. Now, firstly, we have the ice bag. An ice bag is usually used to cool down wounds or burns that a person has. It is usually filled with ice and put in the refrigerator for it to chill. An ice bag can usually be substituted with a towel soaked in cold water, depending on its purpose. Now, next, we have the foot support. A foot support is used to make the patient comfortable when eating or sleeping. It is usually used when a person has sprains or when they break their ankle or if they have any broken bones. Next, we have the measuring glass. These measuring glasses are used in graduating teaspoons and tablespoons used for liquid medication. Then, we have the steam inhalator. Now, this is usually used for people who have asthma. A steam inhalator is used to relieve the patient from clogged nose or difficulty in breathing. Commercial devices are available, but improvised ones can be used with the same results. Linens. Linens are fabric household goods intended for daily use. such as bedding, tablecloths, and towels. Linens may also refer to church linens, meaning the outer cloths used in church. Next, we have the linens. Now, these linens can also be things as simple as a towel or a pillow cover. Your linens can also be things like bed sheets, top sheets, or blankets. If you or your patient has an infectious disease, such as a fever, you should always make sure to wash your linens like your towels or your blankets 3 times a week. You should wash it with disinfectants such as Zonrox or any other cleaning powders. And if you want your fabric to be soft and smooth, you should wash it with a fabric softener. And if you want to kill any other germs that survive the laundry process, you should also iron it to make sure there are no crumbles within the fabric. Eating utensils. Eating utensils are cutlery used for serving and eating food. Spoon. A piece of cutlery with a shallow bowl-shaped container and a handle, used to stir or serve or take up food. Spork. Trademark for a plastic eating utensil that has both tines and a bowl like a spoon. Eating utensils are sometimes disposable. These are a spoon, fork, paper plates, or plastic cup. Next, we have the eating utensils. Now, these utensils can not only be reduced to forks, spoons, or spork, but they can also be paper plates or plastic cups. Now, there are 2 types of eating utensils. We have the plastic or disposable ones. We have a spoon and a fork. These are used for when you do not have any metal ones with you. We also have a plastic spork, which is convenient for when you do not have a spoon or a fork. Next, we have the metal ones. These are usually used in your home or when you are dining at a restaurant. But you can also use a metal knife in which you have to cut things like steak, meat, or lechon. Toilet needs. Toilet needs are used for people with disabilities who cannot use a toilet properly or stand up to go to the restroom. These toilet needs are sputum cup, bedpan, and enema bag. Next, we have the toilet needs. These toilet needs are used for people who cannot go to the toilet or cannot stand up to go to the toilet. Now, these are usually the enema bag, the sputum cup, the urinal, and the bedpan. For people who cannot go to the toilet at all, it is usually for people who cannot move their bowels or have a broken or damaged intestinal tract. Now, they usually use the bedpan for that. So, for people who cannot stand up to go to the toilet, they usually use the bedpan or the urinal, which are at their side or at their bed at all times. Personal toilet requisites. These are used exclusively for the patient. These requisites are hair brushes, soap, cotton buds, towels, and toothbrushes. Now next, we have the personal toilet requisites. Now these objects should not be used by anyone else other than yourself, as it may infect them or it may infect you. These should be used exclusively by you or the patient. Now we have the comb and the hairbrush. Now this is used to get rid of any knots, tangles, or mangles in your hair. And it's also a way to get rid of any dirt or germs in your hair. Now next, we have the toothbrush and the toothpaste. Now a toothbrush and a toothpaste is used to get rid of any dirt on your teeth, your tongue, or your gums. Now next, we have the cotton buds. Now obviously, these cotton buds should not be shared or reused, but it's also important to make sure, as if someone else touches them, all of them, and you use it, it may get their germs on you and it may make you have a disease. These are used by inserting it in your ear and getting rid of all the germs. Now next, we have the soap. This is used to clean your body, such as your face, your arms and legs, your armpits, and your private parts. Now next, we have the towel. It is usually used for people who get sweat or are sweaty. You wipe it on your face, on your back, or even on your chest and your arms to make sure that any of your sweat doesn't affect you. Now next, we have the deodorant. Now this deodorant is used to get rid of the smell that your armpit has, or to make sure that your armpit has a very nice smell throughout the day. Disinfectants. Disinfectants and antiseptics are many active chemical compounds called biocides, which can fight microorganisms on non-living surfaces and human skin. These biocides such as alcohol, iodine, and chlorine have been used for years. Examples of disinfectants are Zonrox, alcohol, and Tide bars. Now we have the disinfectants. Now these disinfectants are used for a couple of reasons, like for sanitizing your hands, cleaning your clothes, or cleaning certain objects. Now these disinfectants can be an alcohol, a Tide bar, or Zonrox. A Tide bar and a Zonrox are used for cleaning clothing, like this t-shirt. This t-shirt is obviously infected with my germs and other things. If you use a Tide bar or a Zonrox to clean it, then it will be cleaned and removed all the germs. And if my hands are dirty, which they are not dirty right now, but if they were dirty, I can use an alcohol to disinfect them, like this. You usually put your palms together like this and rub them to remove the dirt or the germs. Cleaning supplies. A cleaning product is a blend of specialty materials used to remove soils and stains from a surface and to restore the surface to its original condition. Cleaning products are also used to help remove unwanted microbial contaminants from a surface. Cleaning products are usually disposable to remove the risk of unwanted infections. These cleaning products are gloves, tissues, hand towels, and plastic bags. Next, we have the cleaning supplies. These cleaning supplies are usually used in day-to-day situations. For example, I had a piece of food that I was eating, and the residue from the food was getting on my hand, and I didn't have enough time to wash it, so I take a piece of a tissue. Now, this tissue can be used to get rid of the residue on my hand, and now I fold it up and I throw it properly in the trash can. Next, I have a spillage on the kitchen table. Now, I can use my kitchen towel for it to be clean. I could press the towel on the spillage for it to be dry. Next, we have the plastic bag. This plastic bag can be used to throw away things such as like your feces. And next, we have the gloves. I do not have any gloves with me right now, but we can safely say that these gloves are used to touch things that cannot be touched usually, or are dangerous or are toxic, like your feces, your urine, or any other dirty stuff that you cannot touch. Medical dressings. A dressing or a compress is a sterile pad applied to a wound to promote healing and protect the wound from further harm. A dressing is designed to be in direct contact with the wound as distinguished from a bandage, which is most often used to hold the dressing in place. Many modern dressings are self-adhesive. These dressings are usually cotton, betadine, bandage, and band-aid. Now lastly, we have the medical dressings. Now, a medical dressing is used to protect your wound from any harm and to prevent any infection. We have the betadine, the cotton, the bandage, and the band-aid. But excluding those, we also have the hydrogen peroxide. Now, for example, I had a very large cut and stitch on my arm, and it is dirty, it is bleeding. I could use the hydrogen peroxide, pour it on a piece of cotton, and put it all over my stitch to make sure that it is disinfected properly and cleaned. Now, speaking of cotton, we have the cotton. A cotton is used to stop any bleeding or to clean any wounds. Then, we have the band-aid. The band-aid is used to protect or heal small wounds, such as small cuts or small burns. Next, we have the betadine. This betadine is paired up with the band-aid and the cotton. For example, I had a very medium cut on my hand. I could pour the betadine on a piece of cotton, put it there, let it stay, then put the band-aid over it to make sure that it doesn't fall. Next, we have the band-aid. I had a very small cut on my hand. Then, it is bleeding very hard. I could wrap the band-aid over it to make sure that it doesn't bleed. Now, after that, I cut it. But what happens if I don't know how to lock it? Well, don't worry, because on the bandage, there is already a lock in there. This is the lock, so you can put it on it. See? Now it is long.